Dr. Douglas Superman Robinson, Campbell Podiatry. I'm going to talk to you about a common condition that affects the two little ball bearings underneath the big toe joint. These are on the bottom. They're called sesamoid bones. Think of them as sesame seeds, and they're analogous to your kneecap. These little bones help to direct the movement of your big toe, and they can get injured from pressure. Dancers get injuries to these or cause inflammation, especially ones that are going on point or doing plies where they're putting a lot of pressure on the ball of the foot. Basketball players get these injured, soccer players do, runners do, where these will become inflamed. And it's normal to have a ball bearing on the inside and a ball bearing on the outside, but there can be a variant that encompasses anywhere from 4% up to 20% of the population, that instead of having a single one on the inside, single one on the outside, it's split. And the split can be from it fracturing, or it's a normal variant that you were born with it split. So when we read an x-ray, radiologists or podiatrists will commonly say bipartite, meaning 2 points of a sesamoid or an old fracture of the sesamoid. If it looks jagged, swollen, really tender, it's probably fractured. But many people will have them just inflamed, and when they're just inflamed, they're called sesamoiditis. When we add itis to a diagnosis, that means just inflammation. The only way to know for sure if it's broken, aside from x-rays, is that an MRI shows bone marrow edema, and that would be consistent with a stress fracture or an actual occult fracture. So this is very painful when you're walking during the push-off phase of gait. When you take your heel off the ground and you push off, it pushes those into the floor, into your shoe. Very, very painful. So there's two ways that we go about getting you immediate pain relief. One is we offload this by using a dancer's pad. These are washable and reusable. They're made by Dr. Jill's. And we put this on the areas surrounding it, so when you stand, instead of the peak loads going here, it spreads it out. So it offloads that area. If this feels good, and you've had this for a long time, then I will design an insert that has this built into it. I make a prescription insert called an orthotic that has this same accommodation built into it to offload the sesamoids. That's what gives you more purpose when you walk and much less pain. But what do we do about the pain? Well, we do something without medicine. We use a laser, and this is called a Remy Laser. And Remy is not a chemical name. Remy is the manufacturer's dog, which is a Yorkshire Terrier. And we do this directly around the sesamoids. It's a type of therapy that we do weekly to reduce pain and inflammation and swelling. It's called photobiomodulation. So that's what this class 4 laser does. And this is how we get sesamoids to feel better. And if you've had this for a long time and we start this treatment, we'll make you the insert so that we can long-term manage your pressure, taking it off that area that gives you comfortable steps. So we can reach more people to help them and get them feeling better. And if you like this YouTube video, please click the subscribe, and that will help other people to benefit from foot and ankle care.